Good afternoon, students. Today I will start the remaining part of physiological parameters. In previous lecture, we have seen the definition, then hematological parameters. In hematological parameters, RBC's count. Red bulls listed the significance of RBC count. In RBC count, packed cell volume or hematocrit, then mean corpuscular volume and hemoglobin. Okay. Now today's I will start the next point. WBC, white blood cells. Firstly, I will revise the previous part of this chapter. Okay. Firstly, definition of physiological parameters. Physiological parameters is defined as the gases used to check normal physiological form of organ or organelle system. Then hematological parameters. First is RBCs, then second is WBCs. In previous lecture, we have seen the RBC count. RBC count, normal value in RBC count. Human blood. Normal value of RBCs in the human bloods are male 5 million per CUMM, then female 4 to 4.5 millions per CUMM, then fetus 8 millions per CUMM. Then significance of RBCs count. Increases the number of RBCs count indicates polycythemia due to the dehydration, exercise and lack of oxygen, etc. Then decrease in the RBCs count shows anemia, leukemia, old age, and snake poisoning, also called as the hemolytic poison. Okay. Then in RBCs count, first point is packed volume cell. Call volume. Packed call volume is PVC or hematocrit. Okay. It in normal value is male 0.4 to 54, female 0.37 to 0.47. And significance of packed call volume is increase in the PVC indicates the polycythemia or dehydration. Then increase in the PVC indicates the anemia or hydration. Okay. Then next is B, mean corpuscular volume, MCV. Then ratio of it is the ratio of hematocrit to RBC count. Okay. Then MC is equal to hematocrit percent into the 10 divided by the RBC count. This size of the RBC is determined by the MCV. The normal value are 75.99 FL in adult male and female. Okay. Then next is hemoglobin, that is HB. In HB, the test counts the amount of the hemoglobin gram per dl of whole blood and gives the idea of the oxygen carrying capacity of blood. A decreases amount of the HB causes anemia. Then the normal value is male 14 to 16 gram percent, female 12 to 15 gram percent, infants 16 to 18 gram percent. And significance of hemoglobin is and increases the percent of HB indicates polycythemia and dehydration, and a percent HB reflects the anemia and leukemia. Then color index. Color index is defined as the relative amount of the hemoglobin present in the single RBC. Then color index is equal to the HB percent divided by the RBC percent. Okay. The normal color index is 0.85 to 1.5. Significance is in color index less than the 0.85, it decreases the hypochromic anemia. If color index is more than the 1.15, it indicates hyperchromic anemia. Then ESR, that is erythrocyte sedimentation rate. In erythrocyte sedimentation rate, erythrocyte have a tendency to settle down because of their greater density than plasma and Rulex formation. It a blood with anticoagulant is placed in the long vertical tube. The sedimentation of erythrocytes occurs leaving small clear plasma at the top. It is measured as the mm per hour. It is generally measured by the two methods with normal value. Then first method is Winthrop and second is Westergreen. Okay, in Winthrop, male 3 to 5 and female 4 to 7 ESR mm per hour. Then Westergreen, male 0.0 to 9 and female 0 to 12. Okay, then significance is significance of erythrocyte sedimentation rate is uh, despite the diagnostic tools, ESR is preferred for the prognostic value for diseases. ESR shows the increase in the condition like tuberculosis, leukemia, pneumonia, and arthritis, and malignant tumor, and myocardial infarction. ESR shows the decrease in polycythemia, sickle cell anemia, etc. Advantages. First is ESR is useful to follow the clinical course of the disease to distinguish disease which have almost the same sign and symptoms. Example, angina pectoris shows no change in the ESR. Myocardial infarction indicates the increase in the ESR. Okay. Now I will start the next point is today's lecture. WBC, white blood cells leukocytes. Okay, the WBC or total leukocytes, that is TLC, count states the number of WBC in the per CUMM of whole blood. The normal value of the WBCs are as follows: in adult 4,000 to 10,000 per CUMM, in children's 6,000 to 11 1,10,000 per CUMM, infants 8,000 to 13,000 per CUMM, and newborn 10,000 to 20,000 per CUMM. Okay, then significance of WBC is an increases in the WBC count causes the leukocytosis due to infections. Decreases in the count of WBC leads to leukopenia due to viral infection or toxic effector drugs. Then in first DLC count. Okay, the different leukocytes WBC. Differential leukocytes counts gives the distribution and morphology. Granulocytes, that is neutrophils, eosinophils, and rusophils, and agranulocytes, that is monocytes and lymphocytes. The normal range of the different leukocytes is as below. The name of the leukocytes, percent count and absolute count, CUMM. The neutrophils, percent count 60 to 70% and absolute count in CUMM to 2,500 to 7,000. Okay, then eosinophils 0 to 4% and absolute count in CUMM is 0 to 4,000. Then basophils 0 to 1% and 0 to 100 absolute count CUMM. Then monocytes 4 to 8% and 115 to 800 CUMM. Then lymphocytes 20 to 30% and 1,000 to 3,000 absolute count of the CUMM. Then significance of the WBCs is first, neutrophils. Increases in the neutrophil count. The response may occur in the viral infection. For example, chickenpox, herpes zoster, and smallpox. Then, in acute bacterial infection like the urinary tract infection, pneumonia, whooping cough, and septicemia. Okay, then in inflammatory disease like rheumatoid arthritis, gout, acute rheumatic fever. Then next is significance is neutropenia, decrease in the neutrophil count in infection like the typhoid, influenza, Kala-Azar, and tuberculosis. Then in gangrenous ulcer of mouth and throat. Then next is basophilia. In basophilia, increases in the basophils count. First is in acute viral infection like the mumps, chickenpox, and hepatitis. The second is chronic infections, increases of the tuberculosis, syphilis, and hepatitis. Then third is in hepatopoietic disorders like and lymphocytic leukemia. Then next is carcinoma of breast. Also the demonstration increases in the count of the basophils. The next significance of the WBC is the eosinophilia, that is an increases in the eosinophils count. First is allergic disorders like asthma, hay fever, eczema, and food allergy shows the increases in count. Then chronic skin diseases, jaundice, and leprosy may increases count of the eosinophils. Then parasitic infection caused by the ringworm, hookworm also increases the count. Then eosinopenia, that is decreases in the number of count in some acute infections trace situation. Then in Cushing disease, that is hyperfunctioning of adrenal cortex. Then next is monocytosis, that is increases in the count of the monocytes. It may occur in the tuberculosis, substance endocarditis, then monocytes, leukemia, and typhoid fever. Then Kala-Azar, Hodgkin's disease, etc. Then last one is lymphocytosis and increased numbers of the lymphocytes. In lymphocytes, acute viral infection, mumps, chickenpox, and viral hepatitis show increase in the numbers of the lymphocytes. Then chronic infections such as the tuberculosis, pertussis, and syphilis, and lymphocytic leukemia. Then next is thrombocytes, that is also called as platelets. In thrombocytes are the functional form element of blood and are involved in the blood clotting after vascular injury. The normal range for thrombocytes count is 1.50 thousands to 3 lakh per cmm. Thrombocytopenia results from the decreased productions of the platelets, may result from bone marrow dysfunctioning. Then thrombocytosis occurs from the increased productions of the platelets, may result from the inflammatory disorders, blood disorders, and malignancy, etc. In that, first is bleeding time. Bleeding time of the measurement of the hemostatic efficiency of blood, it determined as the time required causing the hemorrhage from a puncture wound. The normal value of the bleeding time ranging from the 1 to 3 minutes. Then significance, it is related with the platelets functional disorder. Long course of the anticoagulant or aspirin. Significance of thrombocytes is it is related with platelets functional disorder, and second is long course of the anticoagulants or aspirin. Then clotting time. Clotting time is the vitro testing of the hemostatic efficiency of the blood. It is the required to clot the blood outside the body. The normal value of the clotting time ranges from the 4 to 10. Then significance is increases in the clotting time indicates hemophilia or presence of the circulating anticoagulants. Okay, understand? Now I will stop here. Thank you.